In the bustling medical landscape of Houston, one name has become synonymous with a quiet but powerful revolution in healing. Dr. Robert Parker began his distinguished career as a top nerve surgeon. For years, he skillfully wielded a scalpel, meticulously repairing the intricate pathways of the human body. His work was demanding, and it offered relief to countless patients. Yet he often saw the limits of traditional surgery and medicine. He saw patients who endured invasive procedures only to face long recoveries or persistent chronic pain. He knew there had to be a better, less aggressive way to help the body mend itself from within. This deep-seated desire for a more fundamental solution started him on a new path. This path led him away from the operating room and into the groundbreaking world of regenerative medicine. Dr. Parker saw a future where the body's own innate healing mechanisms could be harnessed to fight disease. He became a pioneer, shifting his focus from surgical intervention to cellular therapy. This was not a simple change. It required immense dedication to learning a completely new field. He immersed himself in the science of stem cells, recognizing their incredible potential to treat the root causes of diseases, particularly those driven by inflammation. He envisioned a new type of medicine, one that worked with the body, not just on it. His journey was a courageous leap into the medical frontier. Dr. Parker's transition was driven by a simple yet profound observation. Many chronic conditions, from joint pain to neurodegenerative disorders, are fueled by persistent inflammation. Traditional treatments often manage symptoms with powerful drugs or replace damaged parts with surgery. But what if you could calm the inflammation at its source? What if you could give the body the tools it needed to regenerate damaged tissue on its own? This is the promise of stem cell therapy. Dr. Parker understood that these remarkable cells could act as the body's own internal repair system, offering a new kind of hope to patients who had run out of conventional options and were seeking a gentler, more effective path to wellness. His pioneering spirit was a perfect match for the city of Houston. Known for its world-class medical center and its legacy of pushing boundaries in space exploration, Houston provided fertile ground for innovation. Dr. Parker's work began to attract attention, not just from patients, but from fellow researchers and medical professionals. He was not just introducing a new treatment, he was helping to build an entire ecosystem for regenerative medicine in the heart of Texas. His efforts were instrumental in establishing Houston as a place where the future of medicine was not just being discussed, but actively being practiced. He was turning a powerful scientific concept into a clinical reality for his community. So what exactly are these incredible cells that captured Dr. Parker's imagination? Think of stem cells as the body's master building blocks. They are unique, unspecialized cells that have a remarkable ability to develop into many different types of cells. When you are first developing in the womb, stem cells are what build your entire body, your heart, your brain, your bones, and your skin. But even after you are grown, you still have reservoirs of stem cells throughout your body. These adult stem cells, particularly types like mesenchymal stem cells or MSCs, lie dormant, waiting to be called into action when your body suffers an injury or disease. They are your natural on-call repair crew. The magic of stem cells lies in two key properties. First is their ability to self-renew, meaning they can divide and make more copies of themselves. This ensures you always have a supply ready for repairs. Second, and most importantly, is their ability to differentiate. This means an unspecialized stem cell can transform into a specialized cell, like a cartilage cell, to repair a worn-out knee, a muscle cell to heal a tear, or even a neuron to help mend nerve damage. When introduced to a damaged area, they receive signals from the surrounding tissue that tell them what kind of cell is needed. They then begin the process of transformation, integrating into the tissue and helping to rebuild it from the inside out. Stem cell therapy offers a powerful alternative to traditional drugs and surgery. Many conventional treatments focus on managing symptoms. For example, anti-inflammatory drugs can reduce swelling and pain, but they don't necessarily fix the underlying damage causing the inflammation. Surgery, on the other hand, often involves cutting away or replacing damaged tissue, which can be invasive and require a long, difficult recovery. Stem cell therapy works differently. It aims to address the root cause of the problem by providing the raw materials for regeneration. The cells actively work to reduce inflammation and promote the growth of new, healthy tissue, offering a path to true healing rather than just symptom management. This regenerative approach is giving new hope to people living with chronic diseases. For conditions like osteoarthritis, where cartilage has worn away, stem cells can potentially regrow new cartilage, restoring function and reducing pain without a full joint replacement. For autoimmune diseases, where the body's immune system mistakenly attacks itself, stem cells can help modulate the immune response, calming the attack and reducing inflammation. Recent breakthroughs are expanding these possibilities even further. We've seen positive results in treatments for chronic lower back pain, heart failure, and even neurodegenerative disorders. The science is moving quickly, and the potential to change lives grows with every new discovery. Dr. Robert Parker's vision did more than just help individual patients. It helped transform Houston into a leading center for regenerative medicine. His work acted as a catalyst, attracting talent, investment, and research to the city. As he demonstrated the real-world success of stem cell therapies, other clinics and research institutions began to follow suit. Houston's existing reputation as a medical powerhouse provided the perfect infrastructure for this growth. The Texas Medical Center, already the largest in the world, became a natural home for this cutting-edge science. Dr. Parker helped bridge the gap between laboratory research and clinical practice, making these advanced treatments accessible to the community. The impact on patient care in the region has been profound. People who once believed their only options were lifelong medication or major surgery now have a new avenue of hope. A patient with debilitating knee pain from arthritis who was told a knee replacement was inevitable might now consider a simple injection of their own stem cells. This procedure could help them avoid the risks and long recovery of surgery while promoting natural healing. Dr. Parker's clinic, and others like it, are offering personalized treatment plans that use the body's own healing power. This patient-centered approach is changing the conversation around chronic disease from one of management to one of reversal and recovery. Houston's leadership in this field is also strengthened by its connection to another frontier space. Researchers have discovered that studying stem cells in the microgravity environment of the International Space Station unlocks new secrets about how they work. In space, stem cells grow differently, often forming more complex three-dimensional structures that better mimic human tissue. This unique environment helps scientists understand the fundamental mechanisms of cell regeneration in ways that are impossible on Earth. Houston, as the home of NASA's Johnson Space Center, is uniquely positioned to translate these cosmic discoveries into medical breakthroughs right here on the ground, further cementing its role as a global leader in innovation. This synergy between medicine and space science is just one example of Houston's forward-thinking spirit. The city is now at the forefront of medical advances, from developing organoids, tiny lab-grown mini-organs, to test new drugs, to pioneering allogeneic therapies using donor stem cells. The global market for stem cell therapy is exploding, projected to reach nearly $55 billion by 2033, and Houston is claiming its share of that innovation. Thanks to the early vision of pioneers like Dr. Robert Parker, the city is not just a participant in the stem cell revolution, it is one of its most important leaders, driving the future of healing. Looking ahead, the future of stem cell therapy is incredibly bright, and it promises to reshape medicine as we know it. We are moving beyond just treating symptoms and are entering an era of true regeneration. Imagine a future where a heart attack is not a permanent scar on the heart muscle, but an injury that can be healed with an infusion of new cardiac cells. Imagine a future where spinal cord injuries are no longer a life sentence of paralysis, but a condition that can be repaired. This is the world that researchers and clinicians like Dr. Parker are working tirelessly to build. The progress we are seeing is accelerating, with new breakthroughs happening all the time. Recent advancements highlight just how quickly this field is evolving. In the past year alone, we have seen major progress. In August 2024, the FDA approved a new allogeneic stem cell therapy for blood cancers, offering hope to patients with limited options. Just a few months earlier, a major pharmaceutical company launched a clinical trial using stem cells to treat heart failure. We've also seen promising Phase 3 results for treating chronic lower back pain and new therapies approved for knee osteoarthritis. Each of these milestones brings us one step closer to making regenerative treatments a standard part of medical care for a wide range of debilitating conditions. Of course, challenges remain on the path forward. The cost of these therapies can be high, and navigating the regulatory approval process takes time. There are also important ethical considerations to manage, though the field has largely shifted to using adult stem cells, which avoids many of the earlier controversies. But the momentum is undeniable. Increased investment, technological advancements in cell processing, and a growing body of successful clinical evidence are all driving the field forward. The collaboration between research institutions, private clinics, and industry leaders is creating a powerful engine for innovation that is overcoming these hurdles one by one. For patients everywhere, this progress translates into one simple but powerful word: hope. It is the hope that chronic pain does not have to be a life sentence. It is the hope that a degenerative disease can be slowed, stopped, or even reversed. It is the hope that the body, with a little help from its own master cells, can perform incredible feats of healing. Pioneers like Dr. Robert Parker in Houston have lit the way, showing us what is possible when we dare to look beyond the conventions of today. The future of medicine is not just about finding new drugs or better surgical techniques. It is about unlocking the regenerative potential that lies within us all.